thank you very much indeed for joining the weekly Greater Manchester COVID-19 press briefing. Joined today by Sir Richard Leese, who leads on health for Greater Manchester. So to provide an overview of our current situation with regard to cases, I'm going to hand over to Richard to present that to you. Richard.
Thanks, Andy. We're going to put the table up so you can see the cases. Be helpful? We're not. Okay. I'm going to run through what figures we're using and why we're using those figures. Again, I know we've done it previously, but I think it's important to understand, not least because we will have seen some figures published this week that appear to be inconsistent with each other, and want to explain what those are. We use a number of major sources. We use a number of 111 calls on a rolling average over a week to see how many people are seeking medical attention. Where for testing, we use the positivity rate for the testing, but probably the most significant one is the incidence measure, where we use a 7-day rolling average of the cases per 100,000 people in population. We use a 7-day rolling average because you do get very significant fluctuations from day to day, up and down. By using a 7-day rolling average, it smooths that figure out and gives a more accurate picture of the overall situation with the number of cases. And we do it per 100,000 population because that gives an idea of the density of cases at any particular point. The data we've been using now for, I think, about 4 weeks, it's a 7-day rolling average, but it is from 4 days ago. And the reason we use from 4 days ago is that if we were to use today's data, we would have to correct it over the next couple of days, because there is always a refinement in the data, and that's nearly always the number of cases go up over that period of time. They don't go down. So by giving it 4 days in arrears, we're able to give an accurate picture, and we're also, by publishing the same data every week, we are able to see real comparisons between the previous week and, of course, between different parts of Greater Manchester and different parts of the country. Earlier this week, and I'll come back to Oldham. Oldham published data which was using basically case level information, which is really only available to directors of public health. It comes from Public Health England, so it's not available to a wide audience of people. And they decided to publish that as really to give an early indication of direction of travel. But you'll see from the figures we're publishing today, even with them using that slightly more up-to-date information, when we're using the 4-day figure, it is still corrected and corrected up again. So those are the figures we're using. That's why we're using them. If we look at the number of 111 calls, we are still seeing that very stable, and it's a relatively low number. So very few people are seeking medical attention. Over the last week, hospital admissions have halved again and are now minimal. And delighted to say that although a small number of deaths compared to where we were months ago, is that we are seeing very few deaths arising from COVID-19 now. So the vast number of people who are testing positive for COVID-19 are either asymptomatic or that they have very low level of symptoms. And we can't tell yet, we don't know, we don't have the data that says who was asymptomatic, who wasn't asymptomatic, but what we do know is that the overall level of symptoms is very low. If we look at the positivity rate, relatively small fluctuations. The only place that has a positivity rate above the 5% mark is Oldham, which puts it as an amber classification for the positivity rate. When we turn to the case levels, then All but 3 districts have had an increase in their case levels. The 3 that have gone down have been Salford, Trafford and Wigan. And clearly Wigan is a complete outlier. I've no doubt Andy might want to say a bit more about that in a minute. Wigan continues to be a complete outlier, bumping along at in between 7 and 8%, 7 or 8 cases per 100,000 people. The most significant change over the week by a long way is Oldham, which has gone up to 108.8 cases per 100,000 people. Got positivity rates there. I don't know where that table, ignore the table you've just seen because I don't recognise any of the figures in that. Oldham's gone up to 108.8 and Oldham is, in terms of case incidence, is the only part of Greater Manchester that is in, and that table's still not the right table. Can we take it down until we can find the right one, please? Because that's July the 7th, not August the 8th. So Oldham is the only district that is in a red rating. What do we know about what's happening in Oldham now? The cases appear to be fairly randomly spread. There is no apparent pattern. There are no major outbreaks in workplaces that could account for a significant increase. There is no specific data that would link back to, for example, the opening up of the hospitality businesses. We know that most of the transmission appears to be in home, but it's still difficult to identify any particular sources for where the virus is originating in Oldham. What they're doing about it at the moment is they've really upped test and trace. They're doing about 1,000 tests a day at the moment. They've really upped their contact tracing, so more boots on the ground, using their own resources, and we now have the right table, I'm delighted to say, using their own resources for contact tracing. That contact tracing is not simply to get people who might have been in contact with people who tested positive to isolate. It is also contact tracing going backwards to see if they can find the origins of where the infection is from as well. The expert view from epidemiologists and from the Director of Public Health is that at the moment what they are doing is what is required to try and bring the current situation under control. There is no evidence to support at the moment that additional lockdown measures would improve the chances of reducing the number of cases. Clearly, as that intensive test and trace work goes on, that ought to provide us better evidence of exactly what is happening in Oldham. And it's on evidence base that if we are going to support any different measures, it will be using that evidence. Again, elsewhere in Greater Manchester, largely increases rather than decreases, but relatively moderate increases, certainly compared to Oldham. So if Wigan's an outlier at one end, then Oldham is an outlier at the other end. And clearly, as we go forward, that we want to make decisions on all of those places, but on the evidence that we've got before us. I think that covers perhaps yeah, I think that covers pretty much what I want to say about the figures.
Thanks very much indeed, Richard. So to give you some more information about what we do about it, obviously it's a challenging situation that we're looking at across Greater Manchester, and I think it shows that the government was right 2 weeks ago to suggest the further restrictions on social gatherings in the home, and of course we supported that and continue to support that. But we clearly need to bring the numbers down in a number of our boroughs. So the main message I've got today is that everyone needs to get more serious about doing what we can to bring the situation back to a better level. And when I say everyone, I'm talking about pubs, restaurants, supermarkets, and of course everybody following the regulations as set out. So getting the public to work with us, because in the end this is about obviously everyone's health in Greater Manchester. Just to start though by taking you through a letter which Sir Richard and I are today sending to the Secretary of State for Health, because we need to put clearly to the government the way we see it and how we want to proceed from here. And the first thing that we've said to the Health Secretary is that we don't believe, given the picture that's just been presented to you, that it would be right to see the further relaxation with regard to the opening of a range of additional business premises this weekend or in the near future. So we're saying, from a Greater Manchester perspective, we would not want to see that further relaxation covering institutions like casinos, ice rinks, a whole range of different institutions, with the exception, I have to say, of the beauty industry. We do believe, given the way in which salons are regulated, there is a case and there is an anomaly here between allowing barbers but not allowing the beauty industry. But with that one exception, we are asking the government not to proceed with the easing of the restrictions on those businesses at this particular time, but that it be reviewed on a weekly basis, because we understand, of course, that those businesses want to get back as quickly as possible. So that's the first thing that we've said to the Health Secretary. The second is that we continue to support the restriction on social gatherings in the home that the government brought in 2 weeks ago, and we need to continue to get the message out about that so that it can have an effect. And from the figures presented today, perhaps it is beginning to have effect in some of our boroughs, but we need to see more. So hence we continue to support that. And we would say to the government that we need to continue to work as one Greater Manchester system to particularly provide support to Oldham. And we will be doing that, putting more resources in on the ground to support the efforts of the teams in Oldham to trace contacts and, of course, get the message out to all communities. So we're saying for this week, we need to, in a very highly visible way, increase the presence on the ground, put more resources in to get the message out, and of course improve efforts with regard to contact tracing, and that alongside the broad GM restriction that we have in place at the moment. We're asking that that stays in place for this week, with then a view to looking again next week, depending on where the figures go from here. What I would say is, of course, you've got two extremes. You've got Wigan at one end and Oldham at the other. And of course, we would need to keep both of these situations under review. Whether or not we would then say that it would make sense not to have the restrictions in Wigan is a question that we need to keep on the table. We don't think it's a question for this week, but it may be one for next or the week after, whether or not we can relax those requirements in the Wigan borough, but also whether or not there needs to be a strengthening of actions with respect to Oldham. And we want to do this in partnership with the government and in discussion, because it would be extremely challenging to consider a local lockdown of the style we saw in Leicester in Greater Manchester, given that the borough boundaries are very permeable. People cross those boundaries thousands of times a day. Nobody lives their life within one borough. To implement a lockdown in one part of Greater Manchester would be a very challenging thing to do. But we want to keep lines of communication open with the government about the right intervention to obviously bring things moving in the right direction. So that's the substance of our letter to the Health Secretary that we're sending today. And it's very much a message that the Greater Manchester system is working with our colleagues in Oldham to provide whatever support that we can. And it's a watching brief, if you like, given where the cases go over the coming days. But there are two further things I just would want to mention to you all. The first is, I think we need to see a much higher degree of compliance with the guidance, particularly around the test and trace requirements in pubs and restaurants across Greater Manchester. I think more observed in restaurants, but particularly in pubs, we are hearing from members of the public that there is patchy implementation of the requirements, particularly to take people's names and addresses when they are coming in. So my message to the industry today is, we have given you support to reopen, but you now need to fulfil your side of the bargain. This guidance has to be implemented, and what you will see is much higher profile, targeted enforcement, taking action against those premises that are refusing to follow the guidance. And that's a view supported by all 10 of the boroughs of Greater Manchester, that we need to see the pubs particularly implementing the measures, capturing people's names and addresses, so that we can then make sure that the test and trace system is working as well as it should do. And the message goes out to colleagues in the pub industry: we need you to get more serious about this. We need your support, and we need it now. And we hope that message will get through. It's not all pubs. We know many are doing the right thing. It's not a criticism of the whole of the industry, but there are some establishments that are letting the industry down, and that needs to change, and it needs to change quickly. Also with supermarkets, we hear reports that there's variable implementation of the wearing of face coverings within supermarkets, some having checks at the doorway, others not, others having a more permissive approach to it. I'll be writing to the 4 main supermarkets today to say that in Greater Manchester, we do not consider that approach as acceptable. We want to see a much stricter approach to enforcing wearing of face coverings when people arrive at the supermarket, and if people refuse to do so, that they also then be asked to leave. And we do not believe that is too onerous to ask that. We can't leave that to the police. We need to see the supermarkets stepping forward and playing their part here, recognising the situation that we have got in Greater Manchester. So I will leave it there and open up to your questions. Just in summary, to say that we are fully aware of the seriousness of the situation that we have. We do not want to see a part of Greater Manchester go under lockdown. We're doing everything we can to prevent that happening, but it does require everybody pulling together, both ourselves and our councils, but with support from pubs, restaurants, supermarkets, the public as a whole. It's about protecting each other's health, but it's also about not getting into a situation where we see even tougher restrictions come in. So it's a moment where we all need to step back and see what is happening, and follow the guidance, and hopefully push these figures back in the right direction. Ross, I will leave it there, and I'll hand back to you to take us through the questions.
Thanks very much. We've got a lot of questions, quite a lot along a similar theme. So if colleagues do find their questions are asked ahead of us taking them, if they can just let me know, and I'll pull them out. I'm going to take the first 3 questions that are all along a similar theme, from Naomi Cornwell, Helen Pidd and Andy Bounds. So Naomi's from North West tonight. Her question is: how likely is it we will see stronger Leicester-style lockdown measures introduced in all or part of Greater Manchester? Helen Pidd from The Guardian: Andy, are you still wedded to a GM-wide policy on lockdown, i.e. all 10 boroughs should be treated the same, or could you support localised measures such as Wigan being released first and tighten further in Oldham? And Andy Bounds along a similar line: does Oldham prove measures are not strict enough? If a tighter lockdown is required there, should it extend to the whole of GM? So Andy first, and then I'll go to Sir Richard.
Thanks, Ross. So Naomi, thanks for your question. How likely is it? Well, obviously that's a decision for the government ultimately. So that's a decision that you would have to put to them. All I can say today is what we're saying to them, Sir Richard and I, is that we don't believe that is necessary now. We want to continue with the current restrictions, but with much more high-profile work on the ground in Oldham, supported by colleagues across Greater Manchester, to break the chain of transmission and get things moving in the right direction. So we're saying not now. Obviously, we want them to have a discussion with the government about what might be needed later down the line, but obviously we hope it won't come to that. But clearly the figures are a major cause for concern, and we need to do everything we can to turn things around. I would hope the government will listen to us. We are only coming up to 2 weeks of having the first restriction introduced. You would have to consider what a lockdown would do to an area like Leicester, like Oldham, on the Leicester model. It could have serious implications for businesses, serious implications for people's mental health. And the one thing I would come back to the government on is this question about help to self-isolate. You know, why are our poorest communities being hit? It's because of the inability of many people in those places to self-isolate, and this is a real gap in our defences, and we're leaving poorer communities exposed to this virus if we don't fix it. And I say again to the government, please help us plug that gap, because it is a big part of the problem. Helen, I'm not necessarily wedded to this always having to be a GM approach. It was the government that came to us a couple of weeks ago saying they wanted a GM-wide restriction. So it wasn't our call in the first instance, it was the government, but we were happy to support it because it was right. And I think the figures today suggest that absolutely it was the right thing to do. But, you know, given though it's right for this moment now, we will have to keep it under review. And I did hint at the fact that next week we would have to consider the differential position of Oldham at one end and Wigan at the other, and take a view as to, you know, how sustainable a GM approach is with the figures where they are. So right for now, but no, I'm not saying that at all costs it must remain a GM approach. And Andy, on your question, you know, of course, it would be a very major thing to put a lockdown measure across the whole of Greater Manchester. That would have a severe effect on people's lives and the economy. And I would say would be disproportionate given where we are at the moment. The figures are quite variable across our boroughs. What I think we need to try first is a much more targeted approach with regard to the resources that we have to bring things back down in the right direction. And we should have some encouragement in saying that, because obviously in Rochdale, although the figures have gone up again slightly, we have succeeded in recent weeks in bringing them down. Same in Trafford as well. So we've got evidence that interventions work. And I have to say, you know, a lockdown across Greater Manchester is something I've always said I would not want to see, and that would remain my position. Shall I hand over to Sir Richard, Ross?
Please.
Okay, thanks. I said earlier that we need to operate on the basis of the evidence, and just look at the figures there. And this is repeating what Andy said, which said previously, is that we do see most of the districts in Greater Manchester pretty much in the same place. Wigan is an outlier at one end, Oldham is an outlier at the other end. And I think what we want to do on a Greater Manchester-wide basis is make sure that every district is in agreement with the approach that we are taking. But if the evidence says we have to do different things in different places, then we need to do different things in different places. And the evidence is certainly pointing in that direction at the moment. However, something that Andy said then, we're 2 weeks into the measures that are currently operating. And I was listening to the Prime Minister of New Zealand on the radio this morning, Jacinda Ardern, probably thought of a more reliable politician than anybody we've got in this country at the moment. But what Jacinda Ardern was saying in terms of the outbreak in Auckland is that whenever you get an outbreak, whenever you get a cluster, the numbers always go up before they come down. And the likelihood is that we are seeing that in Greater Manchester. It takes at least 2 to 3 weeks for any measures to have an impact. And by next week, we ought to have a far clearer view of if the measures are having an impact or not. If the answer is or not, and Oldham is still at that sort of rate, then the question is, what sort of measures would work? And we could talk about closing pubs and bars and restaurants, but certainly if the weather continues as it is, then all that would happen is that instead of people going into a pub or a bar or a restaurant where, if it's operated properly, they've got the right level of cleansing, they've got the right level of social distancing, they're taking information, people, particularly younger people, will do what they were doing previously, which was going to the nearest supermarket, buying drink alcohol from there and going and socially mixing anywhere. So I think if we are going to take additional measures, we need to make sure that they are evidence measures that will make a material difference, not just displace problems that might exist into another place. I think a stronger line is to do what Andy was talking about, that whether it's shops, bars, restaurants, wherever, is to be far more stringent in making sure that they do operate according to the right rules, to the right guidance. And that is also part of getting a message to the public that our own behaviours are what's going to help get the virus under control. I think the other thing I think that will militate at the moment about taking more extreme action is that although we have a significant number of cases, is that significant number of cases does not appear to be having a great deal of impact. I.e., it is people are asymptomatic or with very mild symptoms. So again, that doesn't argue for taking more strenuous measures when, by and large, people are able to continue to go around doing the work, doing their jobs with actually minimum disruption. And we are in a position where we do have to look at the economic impact alongside all of the other impacts. I shall stop there. Thanks.
Thanks, Richard. Question for Andy from Niall Griffiths at the MEN. The most recent data shows that the number of cases in Wigan has risen marginally, but remains the only GM borough with an infection rate in the single figures. Last week, you said it would be impossible to lift measures on a borough-by-borough basis due to the interconnectedness of the city region. But if the number of cases remain low this time next week, do you accept there will be a stronger case for the government to lift measures in Wigan?
Thanks, Niall. I didn't quite say that. I don't think that it would be impossible to lift measures one by one. What I said was, I think it was a broad comment about it being impossible to just look at one borough in isolation. Just consider one borough alone and not look at the picture around it. That's what I was getting over. I think it was an answer to your colleague Jen. And I think that remains the case. You've got to look at the picture in Bolton, in Salford, when you're considering the situation in Wigan, and obviously the case numbers in Bolton have risen a little, and that's a relevant consideration. But also is the number of tests carried out, and although the number is increasing, Wigan is still the lowest tester in Greater Manchester per 100,000 population. So currently, on the latest figures I've got, 1,331 tests per 100,000 population in Wigan. For comparison, our highest tester is Rochdale, 2,415. So there is, a possibility, let's say, that the case numbers in Wigan aren't fully comparable, if you like, because of that differential in the testing numbers. But I think I said this, Niall. The picture continues to be very different in one end of Greater Manchester to another. Of course, we would have a dialogue with the government about what to do about that, and we're not in a position where we want any part of Greater Manchester to face restrictions longer than they need to. But the case for doing it in the Wigan borough at the moment is obviously preventative. Given what's around people in Wigan, what's on the doorstep, there is a strong chance that we can see those case rises coming to Wigan, and we're trying to prevent that happening. So what I would say is, don't judge it on the case numbers alone. You've got to look at testing, you've got to look at what's happening in neighbouring boroughs as well. But I think what we need to do is do all of this carefully in consultation with the government, as Sir Richard was saying. What worked in Leicester is not necessarily going to be right for Greater Manchester, given the interconnected nature of the city region. And I think we're going to have a very considered approach to this, rather than crude measures that kind of become further divisive amongst different communities and different boroughs. And I don't think that's necessarily the right way to go. We need to be proportionate, targeted, and obviously focus on measures that are going to work, as I think Sir Richard was just saying. And that is the thrust of the letter that we've sent to the government today. No knee-jerk measures, but work with us to get whatever interventions we do right, and obviously make them as effective as possible.
Thanks, Andy. A question for Sir Richard from Niall. If Oldham is showing no signs of improvement this time next week, would you be supportive of a situation where Manchester is put into lockdown alongside it? Thanks.
I think I said earlier that the evidence we've got at the moment suggests that if the figures don't change much over the next week, that we will have to consider a differential approach within Greater Manchester, because we need to have an evidence-based approach. So if the figures are they as they are now, then I'm not sure I would support Oldham going into greater lockdown measures, never mind Manchester going in alongside Oldham. Clearly, if the Manchester position continued to deteriorate, and if you look, the figures have worsened for the last three weeks, then we might need to consider that. The important thing is that this has got to be based on evidence. It's evidence of what the situation is and what the likely impact of the measures is going to be. And I think all of us that go anywhere near Manchester know that social mixing, particularly of our young demographics, started long before it was officially supposed to happen. Turning that around will not be done by simply imposing lockdown measures. We're probably going to need something far more sophisticated that takes people with us. And again, it's a question about what will work in order to really to get people to behave just a little bit more responsibly, taking care of themselves and taking care of other people. Lockdown, I don't think is going to be the way to do it. Certainly convincing people of the need has got to be, getting consent has got to be the right way forward.
Thanks, Richard. Two questions from Joseph Timon at the Bolton News and Bury Times. We'll go to Andy in the first instance. He's saying that they've heard reports that pubs in Bolton could be shut down for not sticking to COVID regulations, and in Bury, mystery shoppers of bars, restaurants and pubs have started. He's asking, have any establishments in GM been shut down by local authorities so far, and what kind of enforcement action can the councils currently take, if you've any view on powers by government? Just add on to that as well, on a separate topic, he's asking about the spatial framework, in particular in Bury, where 12% of the green belt would be developed under the last plan. He's asking when it will be published, and what do you do if a council does not vote to endorse the plan?
Thanks, Joseph. So on your first question, maybe Sir Richard would want to say something about this, because action has been taken against pubs and bars not following the guidance. So, yes is the answer to the question. And the broader point is about, well, how do we get the compliance that we need to see? So there are powers actually that the government have given to us to close establishments if they are creating a serious risk to public safety, given the way the place is operating. So that is something that can be done under the legislation that's been given. Now, of course, we don't want to go around just closing places like that. What we would want to do is do the mystery shopping that you mentioned, but also perhaps issue a final warning. If you don't, then we will. But we will do it, because we can't have widespread non-compliance of the kind that we're seeing at the moment. So this is a call on the hospitality industry. My office has met some of the major pub companies and brewers today, and we had a very good meeting. That we recognise that a large number of establishments are doing the right thing, but they are being let down by a substantial minority. What we need to see is the industry recognise the seriousness of the situation in parts of Greater Manchester, and we need to see commensurate action now, and the industry fulfilling its part of the bargain. And if we don't see that, then we will use the powers, and it won't just be a case of mystery shoppers and final warnings. Then I'm fully prepared to ask Greater Manchester Police to work with local councils to actually close establishments if they are not persistently not following the guidance, having been warned. On the spatial framework, we are digesting what the planning white paper means for the Greater Manchester spatial framework, Joseph. So obviously quite a radical white paper, not necessarily radical in a good way. and it's got implications for the Greater Manchester spatial framework. So we are just digesting what they mean at the moment. If one council decided to step away, as you suggest, my understanding is, and the current way it's progressing, is the other 9 could go together, but we don't want to see that. We want this to be a Greater Manchester wide plan. And our task has not been made any easier by the recent planning white paper, but our intention is to push on, obviously to listen to what the government are saying, but to continue to develop a plan. We hope still that we will be able to bring something forward later this year, but obviously it's subject to taking on board the considerations in the planning white paper.
Thanks, Andy. I'll bring Richard in on the first point, and also any spatial framework thoughts.
Well, I'm not to say anything about the spatial framework, other than for both Bury and Bolton, is that they get more benefit out of the spatial framework process than most other areas, because actually the spatial framework allows places like Manchester, Salford, Rochdale to take a lot of the load off them. They would probably need to take more green belt if they're outside the spatial framework than being within it, because in order to meet their housing total, they'd have to meet it all themselves rather than have it being met by other districts. In terms of what's being suggested might be happening in Bury and Bolton in terms of enforcement around bars and pubs, I really hope it's true. I'll be delighted if that's what they're doing. It's what we said a week ago. We want targeted enforcement to ensure that establishments are following the rules, and if that's what Bury and Bolton are doing, can I say more power to their elbow when we're talking about pubs and bars? I will do anyway. That's what we want everybody to be doing, certainly across Greater Manchester.
Thanks, Richard. Question from Kevin Bailey at the Oldham Chronicle. Oldham Council have begun an information campaign asking residents to act now. Is there any evidence that Oldham residents are failing to comply with the COVID-19 restrictions? And if so, what needs to change to encourage adherence to the rules? Richard, do you want to take that one first?
This is something we talked about last week. And I don't think it's just Oldham. I think we've seen relatively wide scale, certainly not full compliance with the guidance. So we do see people in shops who are not wearing face masks. We do see social gathering that doesn't follow 1 metre plus or 2 metre rules. We're all of us seeing that behaviour all over the place. And really, what has broken down is that people, and I don't think, really understand anymore exactly what it is that they are supposed to be doing all the time. And when we talked about the guidance that came out, we talked about this a week ago, it was very difficult to understand. It was very difficult to explain. And that's what we're doing across Greater Manchester. Again, repeating what we said last week, is to try and make sure that we give people really simple, easy messages to follow, that are clear to follow and make sense, that there is a reason for it that people can understand. And that's how we're going to encourage adherence. It's clear, understandable messages that make sense. People know why they're being asked to do what they're being asked to do.
Thanks for bringing Andy in on that.
Yeah, just to I very much agree with what Richard said. You know, I think there's probably evidence everywhere that all residents aren't complying, and I think generally we need to get that message out again. You know, please, you know, look at the situation, follow the guidance, as difficult as it is, and it is difficult, but it's about everyone's health, as I keep saying. And I would be very worried about a narrative developing here that's all about blaming the public. As I've said, there's more that supermarkets should be doing, there's more that pubs should be doing, and there's certainly more that the government should be doing. Crucially, that question of helping people to self-isolate, getting those contact tracers on the ground in places like Oldham that they've promised. Some of these things have taken too long to get organised, and as I say, it's the poorest communities that are more exposed as a result. So we need to see action in those areas, and I really will challenge a narrative that starts to say, well, it's all the public's fault. It's not. You know, I'm grateful actually that the vast majority of people have done their best to follow the guidelines. We do need to see those who are not listen and change, but we also need to see all those other organisations I've mentioned and the government too playing their part, rather than just doing what might look like an easy route to say we'll put a community under lockdown. Lockdown would have very serious consequences for Oldham or any part of Greater Manchester were it to come in. Agreeing with Sir Richard today, we want to discuss alternatives to that with the government, possibly strengthening the measures, yes, but not to a degree where we just come in with something that will cause real disruption to people's lives. So we need that discussion with the government, but at the same time, we are not underestimating the seriousness of the situation.
Thanks, Andy. A question from Michael at the New Statesman for you. Greater Manchester has seen one of the lowest relative levels of people returning to shops, restaurants and bars in the last week for obvious reasons. Can the GMCA do anything to help restaurateurs who are suffering, and does central government need to offer more than just the Eat Out to Help Out scheme in areas under local restrictions?
Well, I think obviously there is still a nervousness amongst the public. And I think the best thing that we could do, Michael, is make test and trace what it is meant to be, which is the world-beating system that the government have spoken about. And it isn't that at the moment. We have had to argue for more data to be provided to local government successfully. We had to argue for more contact tracers to be reallocated to the ground successfully. Confidence will come from running a proper test and trace system that also allows people to follow requests from test and trace the minute they receive one. And that I'm talking explicitly about people on 0 hours contracts or in the gig economy who are struggling at the moment to do that. And that is the best way we could support all businesses right now. Yes, there is more potentially that could be done. I don't think the government's position on furlough is going to be sustainable. Certain sectors are going to find it harder to return to anything like full strength. So we could think of hospitality, but I would also think of the music industry, and we saw the music industry making that point in central Manchester this week. You could think about events industry, aviation. There's a whole number of industries that simply are not going to be able to return to anything like full operations anytime soon. And I think the government has got to reconsider its position on furlough for those industries. It doesn't make sense to have run a furlough scheme to this point, simply to abandon it when those industries can't fully return. So I think we need a sector by sector approach to furlough. And I think that would be the best way the government could support these sectors.
Thanks. I'll move on to a question from Tom Danbach, unless Richard wants to come in on that point. Nope, fantastic. We'll move on to a question for Tom. Tom at Hits Radio asks, Andy, off the back of GMFE's figures yesterday and warnings around A-level parties tonight and this weekend, what's your message to college leavers who are wanting to celebrate?
Well, I certainly understand that people have had a tough year, and today will be a day that's finally a good day where they can celebrate some good news. But our message would be do it within the rules. It might be a sort of a killjoy thing to say, but it has to be within the rules, given the situation that we find ourselves in and the spread we've seen amongst young people. This virus is not something that young people can ignore. It really isn't. This is something that if it doesn't cause damage to your own health, it could be damage to your mum or your dad or your sister or your brother's health. And that's what I would say to young people. Bear that in mind at all times. In the worst cases, this virus has seriously impacted upon people and caused long-term damage. So, you might be celebrating one thing that's about a positive future. Well, don't go and sort of ruin that by creating a negative on what should be a positive day.
Richard, did you want to come in on that one?
No.
Brilliant. Move on to Charlotte Green at the MEN. I think the first point about full lockdown has been covered, but the question was, would you support an Oldham-only full lockdown, and if not, which other areas of GM would be envisioned having lockdown alongside Oldham? But the main question is, if household transmission is the main factor driving rising infections in Oldham, will shutting down pubs and businesses actually have any impact on bringing down the numbers? Andy, do you want to go first on that one? Bring in Richard.
Well, thanks, Charlotte. I think you've heard today, don't want to see a full lockdown, as you say, in Oldham. I don't want to see it anywhere in Greater Manchester. It would have very serious consequences. And clearly there are steps that you can take in advance of something of that kind. The household transmissions issue is why we have the current regulations that we have, and we do need, as Richard said, to give them time to work. So while the figures have been worrying this week, I think we must also not, though, kind of overreact. There is a danger of doing that. We need to operate at all times in a considered and a proportionate way, and we will. But at no point in this whole crisis have we kind of turned a blind eye or not been open about the challenges that we face. But I think to go from where we are today to a full lockdown anywhere in Greater Manchester would present kind of serious difficulties for the public, but also for Greater Manchester services as well. So we are ready to have that dialogue with the government to consider all more targeted measures that might be considered, and we would see a lockdown as a failure of all of those other interventions, and something that would be the very end of the line, and something that should only be considered when everything else has been tried first.
Bringing in Richard on that point.
Well, I think the evidence that we have is that closing down pubs and bars would not have any significant impact at the moment because of what we do know about transmission. Although I have to caveat that is that although the data is improving all the time, and it's certainly improving in Oldham because of the amount of work they're doing on contact tracing, it is still not perfect. And in that imperfect world, it's undoubtedly the case that pubs, bars, restaurants delivering very clear messages to their customers by ensuring that they follow the guidance in full would help reduce cases in Oldham and everywhere else for that matter, because that is largely about people behaving in the right way. So no, I don't think closing pubs and other businesses down will help in any significant way. Doing things that get people to behave in a slightly different way of taking COVID-19 more seriously than they are at the moment, I think would help.
Thanks, Richard. Given we're quite pressed for time, I've got quite a number of questions. I'm going to try and group them as much as I can. So I'm going to take questions on supermarkets. So Andy, Tim Scott at Granada asks, the Co-op are saying they can't put their staff in danger by asking them to enforce mask wearing. What's your message to them? Michelle Livesey asks, regarding supermarkets playing their part, I've had some people contact me about face coverings in supermarkets saying no one's wearing them, and I've seen staff not wearing them either. How important is it, particularly the situation in GM, that supermarkets play their part? And then finally, Judith Moritz, as well as targeting supermarkets, do you have any plans to do more about people failing to wear them on public transport? She also asks if there's any plans for our test and trace services in Greater Manchester.
So thanks everybody, and Tim, to start with your question, I'm not asking the staff, checkout staff or people working in the store to do this. I'm asking supermarkets to have security staff to do this, because most of them do employ security staff on site, and I think it's a very proportionate request to say, can you employ sufficient security staff both to ask people to wear as they enter the supermarket, and to ask people to leave if they refuse to wear one. It's really as simple as that. And let's remember, all of the supermarkets have made a lot of money throughout this whole situation. I don't think it is too much to ask them to put that security presence on site. I think it is unfair of supermarkets to push that off to the police. And that's the request that I'll be putting to all of the supermarkets today. If they say they can't afford to do it everywhere, well, I'm saying you should be doing it in Greater Manchester, given the situation that we face and other areas that are facing extra restrictions. On public transport, we certainly have been using targeted enforcement. We have had high-profile initiatives to get compliance levels higher, and it has got reasonably high. Of course, we'll never get to 100% because some people have a justifiable reason not to wear a face covering or a mask. So, these efforts have got to continue all the while. But I particularly want to see change in supermarkets, and that's an area where I think we can legitimately ask them to do more than they're currently doing.
Richard, did you want to come in?
No.
Perfect. Moving on quickly, Elizabeth Rushton at the Rochdale Observer. In previous weeks, we had seen Rochdale's infection rate be the only one to drop in any GM borough, but they now seem to be on the up again. Are you pinpointing any of the reasons for this, and what is the danger of the borough heading the same way as Oldham?
I think maybe Richard wants to also say something on this, but I would just say that I suppose there's a danger. Oops, have I lost the? Sorry, just very quickly. There's a danger, Elizabeth, in sort of putting too much weight on 1 week, because the figures will fluctuate as we've seen. So, it's not kind of wise, I don't think, to sort of kind of see a change in 1 week and then completely kind of move in one direction. What you've got to do is look at the trend as it develops. So, obviously, there's a need for vigilance in all 10 of our boroughs, given the high number of cases that we have. But I wouldn't advise people sort of, as I say, taking a knee-jerk approach, given any of the figures. And that would be true of Oldham too, because the rolling average can change quite quickly on the back of a couple of days of numbers. So, if you have an average where a day where we've had fewer cases falls out of the consideration of the average, and a day where there's been a high number of cases comes in, you can see a quick change, and we've seen that in Oldham this week. And I think the important thing is not to sort of overreact or panic when you see those things. The way to handle it is to sort of take a considered view, ascertain the long-term trend, and then act accordingly. And while obviously we can see the rise in Rochdale, I would advise that it is only a 1 week set of figures, and it needs to be considered as such.
Richard?
Well, I think it's worth recognising that even with Oldham, that the number of cases in terms of absolute numbers isn't that enormous. So I think Oldham at the peak was talking about 40 cases a day. If 40 cases a day produces a number like 108, which we see in the table, then it's clear that you don't need a big fluctuation in that number of cases for it to go down significantly or up significantly. And the point that Andy's made, that is what we've been seeing on a regular basis. I think at the moment for Rochdale, and it is relatively stable at the moment, and whilst it is relatively stable, and I don't think there will be any need to take any further action, but clearly Rochdale does need to continue doing the things that they have been doing in order to make sure, first of all, they maintain that stability, and then hopefully we see a downward trend in that number.
Thanks, Richard. I think we've got time for just maybe 2 more rounds. So I'm going to go Rowan Bridge question. On the one hand, you said there was no indication that the higher figures in Oldham, where the highest spread is, were linked to the reopening of hospitality. Yet at the same time, you're talking about them needing to take stronger action to tackle the problem. He asks, aren't you criticising the wrong people? And Kevin Fitzpatrick asks on a slightly different note, in some ways, is it a good thing that lots of young people are getting the virus without being ill and are potentially now immune to catching it again, helping the area get herd immunity if it turns out a vaccine is a long way off? Richard, do you want to go first, then I'll go to Andy?
Well, no, we're not blaming people in particular. What I think both Andy and I have said fairly consistently, that in order to bring the virus under control, that a lot of it does come down to, and this isn't blaming people, but it is how we all behave, that we take responsibility for our own health and for the health of others. And the guidance for pubs, bars and restaurants is to allow them to be able to operate their businesses in a way that they don't increase the risk of infection. So we'll continue to do that, not just with those businesses, but with any other business or any other place where where people gather. And that's got to be the case. In terms of whether it's a good thing young people are catching it and so that they're getting immunity, first of all, Kevin, we don't know that catching it gives you immunity yet, so that's not necessarily that good a thing. But something I've said for the last couple of weeks is that young people might catch it, they might have low levels of symptoms, and they might get over it very, very quickly. On the other hand, they might cause themselves long-term lung and heart damage. We have had examples of young people, particularly those who have other health problems, who've died from COVID-19. So young people are not immune to COVID-19. And of course, they are perfectly capable, if they do have the virus, of passing it on to other people, and in particular, people who might be older and more vulnerable than themselves. So I think for all of those reasons, getting lots of young people getting the virus isn't, I think, a good thing. And I'll pick up while I've got it, Ross, the question also about testing asymptomatic people, because it follows directly with this, as Helen's question. It's how people are getting tested. Certainly in Oldham, what's been happening in Oldham, because of the incidence of cases, is that they've been putting in mobile testing, they've been putting in walk-in test centres. There are a place not just in Oldham where a small number of cases have led to whole workforces being tested. So there are a number of reasons why people who are asymptomatic might get tested. There are some sectors, particularly health and care, where people are now being tested regularly as a matter of course. So a lot of reasons why people are asymptomatic might be being tested. And again, we ought to remember that people who are asymptomatic, test positive, have got the virus. And again, they are capable then of transmitting the virus to other people. So it's just as important to know about asymptomatic people as it is symptomatic people.
Thanks, Richard. Andy, and then we've got one final question.
It's okay, I'll just go on to the final question, Ross. Richard, go.
Will do. Final question from Judith Morris to BBC News. You've written to the government to ask them to take your views into account regarding a Leicester-style lockdown. Do you have confidence that they will involve you in that decision, or are you concerned that lockdown may be imposed by the Department of Health at short notice in the same way as the late night announcement which the government made about restrictions a fortnight ago?
Thanks, Judith. I think obviously the point of our letter is to say, well, let's not do that at the very 11th hour as kind of happened last time. It's not to make a criticism. I understand the government needs to act quickly at times. What Sir Richard and I are saying to the government today is, let's take a considered view of the situation and proceed on the basis of consensus about what measures, what is the next set of measures that could be considered in an area like Oldham, short of a lockdown, because we both have said today we don't want to see that, and we want to agree that with the government. Greater Manchester, as we keep saying, is an interconnected place. This is a really challenging thing to do, just to sort of rush to a sort of lockdown situation. We want that dialogue with the government. What confidence do I have? Well, they did approach me last time, and we were happy to work with them on the evidence that we could see that they could also see. So I think our position is, for this week, still not 2 weeks before these regulations have come in, it's right to hold the position that we're in. It's right to supplement that with the additional activity that we're going to see on the ground in Oldham, with the support of the wider GM family. And we need to keep it under very close review. The figures that you've got today reflect a change in the case numbers in the last few days in Oldham. And as I said to an earlier question, it's important not to overreact. You've got to remain very vigilant, but keep things in proportion. So that's where we are at the moment. We want to have that kind of discussion with the government. We've said to them to not proceed with the relaxation that potentially could be happening elsewhere in the country, in Greater Manchester. Keep all of this under review on a weekly basis, Judith. But in between the decision point every week, keep that dialogue working with us, and we think that will be a better way to work than surprising people late at night with restrictions that we saw last time cause a huge degree of confusion and potentially don't bring the levels of compliance that you would want to see, given the confusion that way of working produces. So, that's the purpose of the letter today, and I hope, given the way we've been working with the government in recent weeks, that they will treat it in the right spirit.
I think that's us out of time.
Great. Thanks, Ross. Thank you, everybody. Thanks, Richard.
Thank you.